Shock is the body's response to serious injury or illness. Shock can be life-threatening and happens when not enough oxygenated blood reaches the body tissues. This occurs due to serious bleeding or when the body no longer regulates blood flow to the tissues. In general, always treat an injured or ill patient for shock, even if the signs and symptoms for shock are absent. There are 9 indications of shock, though some occur with other injuries. They are rapid, weak pulse, pale or bluish tissue, moist, clammy skin, possibly with shivering, mental confusion, anxiety, restlessness or irritability, altered consciousness, nausea and perhaps vomiting, lackluster eyes, dazed look, and shallow but rapid labored breathing. By the time you get to shock management, you will have progressed well along the cycle of care. You will have assessed the scene and applied your barriers. Through primary assessment, you would have confirmed the patient's level of responsiveness and that he is breathing normally. Since the patient is breathing normally, there is no need for CPR. If the patient is unresponsive or bleeding, you would have already alerted the emergency medical service. If he were bleeding, you would have treated him by applying direct pressure. To treat a responsive patient in shock, let the patient determine what position is most comfortable, sitting or lying down. To treat an injured and unresponsive patient, do so in the position you find him. If there may be a head, back, or neck injury, don't move the patient and keep his head and neck immobile. More on spinal injury treatment in the next skill. Regardless of whether the patient is responsive or unresponsive, to treat for shock, maintain the patient's body temperature based on the local climate. This may mean covering the patient with a blanket or exposure protection from the sun. If there's no reason to suspect spinal injuries or leg fractures, elevate the patient's legs 15 to 30 centimeters, 6 to 12 inches. This shifts blood to the more critical chest and head areas.